What is up, you guys, and welcome back to my channel. So today's video is going to be all about the careers you can get in forensic psychology and also the degrees that you may need to work in those careers. Side note, I'm sure you have seen this outfit and this makeup before. I filmed my semester recap video before this, so I'm in the filming mood, so I decided to go ahead and film this for you guys right now while I'm in the mode, while everything is set up. So you guys have seen this outfit before, but yeah, I'm gonna go ahead and get right into the video. So I'm just gonna be honest with you guys. You are probably, more than likely, unless you know someone, not going to get a job doing what you want to do with just a plain old bachelor's degree in forensic psychology. You are 99.9% of the times going to have to go above and beyond a bachelor's degree to actually do what you want to do in the field of forensic psychology. So if you want to go in like the clinical psychology route, you can practice with a master's degree. It's like that for any like clinical psychology, no matter if you did forensics or geriatrics or any of that. Like, if you have a master's degree, you can practice in the area of clinical psychology. So if you don't want to get your doctorate degree, a master's degree is always an option. You can go pretty far with the master's degree. Of course, your salary is not going to be as high as if you had a doctorate degree, but you can do a lot of things with a master's degree. If you want to go past that, you can get your PhD or your PsyD, and I will explain the difference. So a PhD is more research based, and a PsyD is more like hands-on clinical based. So I actually surprisingly have a professor at my university who has her PsyD in clinical psych, whereas most of the professors, well, she's the only professor with a PsyD, the rest of the professors have a PhD. So the way she explained it to me was, with a PhD, the school basically says, I'm going to pay you, i.e. they're paying your tuition. So the school is going to pay you to go there to do research. So you're basically working for the school. Whereas a PsyD is a little bit more expensive. I mean, you can get graduate assistantships, but your whole tuition isn't normally waived because it's more clinical and hands-on based. So the school isn't paying you to do research in a sense. So you're basically, it's just like a regular undergraduate degree where for the most part you're just sitting in a classroom and you're learning. So whether or not one holds more weight than the other, not really. I mean, in a sense, they're both doctorate degrees. You're a doctor, you have a doctor in front of your name, no matter which route that you take. I guess it just depends on if you want to do more of a research-based curriculum or if you want to do a more hands-on type of curriculum. PsyD programs also, you can find a lot of them, but there aren't as many as PhD programs, if that makes sense. So there's more PhD programs than PsyD programs. Also, this is always an option. You can also go to medical school. I know you're probably like, yeah, but yes, you can go to medical school and you can become a psychiatrist. You can actually become a forensic psychiatrist. So you would go to medical school, you would do the regular normal curriculum for med school, and then when it's time for matching, you would choose to match in psychiatry, and hopefully you would get matched, and you would do that whole shebang, and then you would do a fellowship in forensic psychology or psychiatry. So there's a few different degree options that you could take. It all depends on what you want to do. I personally am going to tell you to reach for the stars and go as high as you can possibly go. Just, you know, you can always fall back on it. So, of course, the highest paid is going to be the forensic psychiatrist, just because they went to medical school and medical doctors always get paid more. But the salaries, if you have a PhD or a PsyD, are pretty good as well. And then, like I said, if you have a master's degree, the salary isn't as high as if you have a doctorate or if you're a medical doctor, but the salary is pretty decent. So as far as careers in forensic psychology, a lot of people major in forensic psych thinking that they're going to do the whole criminal minds, BAUs, criminal profiling thing, and I'm here to tell you that that's highly unlikely. A lot of police departments and things like that don't really use criminal profilers that often anymore. It's not really a big thing. I'm not saying that it can't happen. I'm not saying that that's not something that can happen for you. If that's a goal of yours, then go for it. I'm not trying to discourage you from doing anything, but a lot of people go into forensic psychology thinking that that's what they're going to do, and that's 9 times out of 10 not what they're going to do. One of the main careers is you would be working with the court systems, or like the prosecution or defense, and basically determining if a patient is fit to stand trial. So you would do a clinical assessment of the patient to see if they can actually stand trial, if they're mentally competent to stand trial, or you can do like clinical, if they're insane, if they are doing the insanity plea, which by the way normally doesn't pass in court. Fun fact. So that's like the main thing that you can do. There are some, if you have very thick skin, there are some careers working with children and false memories, specifically looking at sexual assault victims, or children who have been sexually assaulted, and looking at memories and doing interviews with those children, and also proctoring interviews to make sure that false memories are not implanted. If you guys have been following me, you know last semester I took a psychology of forensic child, where we went over all of that false memory. We talked a lot about sexual assault in children and false memories and all of that stuff that just makes you want to cry, but someone needs to do it because these kids need help. So if you have very thick skin, I don't think I personally could be able to do that. I love kids, but if you feel like you could do that, that's also a career option. Now there is the route that I want to take, which is the clinical route, which has a lot to do with, of course, treatment and therapy and diagnosing and all of that. So I really want to work in the prison systems with mentally, what's the word? I want to work in the prison system with inmates who have mental disorders, and I want to help counsel them. And I also want to work especially a lot with substance abuse victims, domestic violence victims, people of that nature. My main goal is to decrease their recidivism rate with the lessening amount of mental hospitals where people can go. A lot of times those people with mental illnesses end up in jail for little petty crimes, and a lot of them really just need therapy. And I really want to go in there and help them and try to decrease their chances of recidivism if they do have the opportunity to get out. I also want to work with substance abuse victims, because a lot of times a person starts abusing a substance because of past trauma that they haven't gotten over, and they basically use drugs to cope with it. And I want to help them with that, of course, figure out the trauma and figure out why they started abusing the drug. And then once you get past that, then you're more than likely going to be able to help with the substance abuse problem. My biggest thing is, if you have someone, for example, who was raped and started using heroin because they were raped, it doesn't matter how many treatment programs you put them in. If you don't help them deal with the rape, they're not going to stop using the substance, because they're using the substance because they were raped. So that's just, I mean, that's what I personally want to do. I love clinical psychology. That's my thing. If you guys don't know, clinical psychology is my thing. I love clinical psych. I could talk about clinical psych all day, every day for the rest of my life. I love it. It's amazing. It's the best thing since sliced bread. Now, if you go the medical school route, you would basically be doing all of what I just said, but you would be able to prescribe medication. So you may be called by the prosecution to give a statement on the defendant's mental capacity. They may ask you about certain medications that that person is taking, how that can affect their judgment. They may ask you on information on their mental illness, and you would kind of give them information on that, so you can be called in by the courts. You can work in the prison system. You can have them as just like general patients. So forensic psychology is basically, it's just psychology and the law. So any sector of the law that you can think of, a forensic psychologist has probably been there. There have been forensic psychologists who go into police departments to try to implement different procedures and things like that for sexual assault victims, in terms of like memory and things like that. So if you can think of any sector of the law, a forensic psychologist probably needs to be there. So forensic psychology seems like it's a very small little, you know, career, but it's not. It is continuously growing. It is demanded. There are a lot of people who have mental illnesses or other mental deficits that are now entering the legal system, and psychology is the study of behavior. Forensic psychology is the study of basically law and behavior. So you put those two together and it is amazing. If you don't know, I'll let you know now. Law is my second love. I love law. So on one hand, psychology, clinical psych, forensic psych, neuroscience, that is my first love. My second love is law. So anything legal, I love it. So forensic psychology was the perfect fit for me. If you have any other questions, please leave them down in the comments. I will try to answer them. I know I've been getting a lot of questions on all about my forensic psychology major. If you haven't seen that, I will link that as well up in the cards, and you guys can go watch that. But I'm also doing my capstone next semester. So if you guys have any question about my capstone, please leave them down in the comments as well. If you want me to do a whole video about it, I can do that. If you don't know what a capstone is basically like a dissertation, but for undergrad. It's basically this big paper that we do. So we have to pick a 400 level class, which I picked my psychology and the law class, and we're basically going to pick a topic and we're doing this big long paper on it. I think it's supposed to be 10 to 15 pages. Well, it depends on the professor. Some professors make it shorter, some professors make it longer, so I don't really know. But I think the minimum is, I think, 8 pages. And I don't think there's really a maximum. So the professor can make you do whatever. And it's pass or fail. You have to pass your capstone course in order to graduate. So it's very nerve-wracking. So if you guys have any questions about my capstone, if you want me to do a video on it, I can definitely do a video on my capstone course, because I know not a lot of programs require you to do a capstone course. So it could be very beneficial if you guys are interested in that type of thing. Let me know. I can definitely make some things shake. Definitely make it happen for you guys. So yeah. Okay, you guys, that is it for this video. I hope I kind of gave you guys a little bit of information. I was definitely getting some questions on my other video, like I said, on like which degree is better, a PhD or a PsyD, or what can I do with just a master's, or what can I do with just a bachelor's. So I thought I would kind of do a little video on it. So yeah, I hope you guys enjoyed this video. If you did, give it a thumbs up and don't forget to subscribe before you leave, and I will see you guys in my next video.